online on www.wfm917.com. Radio Doctor, Nigeria's first free consultation radio health program on WFM 91.7.
All right, good morning. 5 minutes past 10. You're tuned into Women Radio 91.7 FM, the first and only radio station for women and their families. And yes, you are on to Radio Doctor. My name is Adebola Adeduba. 3rd June 2025, Tuesday morning. Yes, we're here for you. And today on Radio Doctor, we're talking about something very, very important. We're looking at egg freezing and fertility preservation. Who should consider it? Egg freezing and fertility preservation. Who should consider it? This is Radio Doctor, your free health consultation program where real doctors give real advice to real people, of course. And just to mention, Radio Doctor is Nigeria's first specialized health program where medical doctors consult for free, and as well as advice on radio, on Women Radio, which is broadcast live from 10 a.m. All through from Monday to Friday. Once again, my name is Adebola Adeduba, and Radio Doctor today we have the company of Dr. Collins Aboloje. He happens to be an assistant medical director and facility physician at St. Ives Specialist Hospital in Abeokuta. Good morning, Dr. Aboloje. Dr. Aboloje, can you hear me?
Yes, I can. Good morning.
All right, good morning.
Can you hear me?
Yes, I can hear you loud and clear. Glad to have you join us this morning. All right.
Thank you for having me. Always a pleasure to be on the program.
Okay, fantastic. Just to mention to our listener, feel free to call us in the course of the show. I mean, this topic affects anybody. If you're a woman, it affects you. If you're a man, you have a loved one in your life, this definitely affects you. You can reach us on the lines 07000 917 917 or 9155 917 917. Toll-free line for females only. You can do also dial us up on 0800 1235 917. Of course, you may want to leave us your text or your WhatsApp message. You can do that on 08155 917 917. 07031756537. All right, now straight to business. Dr. Collins, today we're looking at something very, very, very critical, and we're talking egg freezing and fertility preservation. And we're trying to examine or x-ray who indeed should consider this particular situation of egg freezing and fertility preservation. Maybe I'd like you to start first by defining it. Just to mention to our listeners, well, we're on social media, we're on Facebook, we are on Instagram, on Twitter, and of course, we're on X, I should say. And of course, we are on YouTube at WFM 917. We're streaming live, just in case you want to drop by and then, listen to us live. Yes, we're streaming live on Facebook. Let me kick off by asking you, Dr. Collins, what really is egg freezing? How does it work?
Okay, thank you very much for that question. So, I know in recent times, this topic has been making the rounds on the media, social media. In fact, I just recently stumbled upon it some days ago. So I was like, okay, I think maybe radio, women radio had to just bring up this topic just to more action. So.
In fact, just a quick chip in there, Dr. Collins, before you proceed on explaining what egg freezing is all about. There is a particular Instagram celebrity by name Ifedayo Agoro who was seen on social media advising ladies to freeze their eggs, and that saw different reactions from people. Some criticizing that advice, some saying it's expensive. Why should you freeze it and all whatnot? Different reactions, basically, to that particular video she made. But so yes, indeed, I'm buttressing your point that this topic is quite timely. So go ahead and explain to us what egg freezing is all about.
Yeah. All right. Thank you. So now, fertility preservation in itself is simply the act of, I will use the word vitrifying, but just for the public, is simply the act of freezing eggs or sperm, in special containers by immersing them into liquid nitrogen, in the lab. And these frozen eggs or frozen sperm, as the case might be, can be frozen for an indefinite period of time, for an unlimited period of time. So the reason why I actually use this definition is because fertility preservation does not only involve the woman. So it's not only women that can freeze their eggs. Men can freeze their sperms to be used for to be used later when they are ready to bear children. Yes. So the main method that is used in fertility preservation is actually what we call vitrification. These are just medical grammar. It's simply an ultra rapid freezing method. So to state this, fertility preservation can be both for women and for men. And now I'll start by talking about fertility preservation in women. So what are the ways through which the fertility of women can be preserved, so to say? Now, in this case, there are different ways. There are about 4 of them, actually. I'll just limit them to 4. So the very first method through which the fertility of women can be preserved is by egg freezing. Yeah, that is the freezing of the eggs of the woman. Egg freezing is usually done at it's usually advised to be done at a particular age range. However, people can still do it, women can still freeze their eggs even at an age that is older than the recommendation. So basically, one of the methods of preserving the fertility of the woman is by egg freezing. The next method is by embryo freezing. That is freezing of embryos. So what are embryos? Embryos are simply cells that are formed from the fertilization of a woman's egg by sperm. So everyone that is a living human being today was once an embryo in our mother's womb. So basically, an embryo can be frozen. So that is also one method of preserving fertility in women. The next method is, of course, ovarian tissue freezing of the ovarian tissue themselves. So women have 2 ovaries. The ovaries are the structures inside of a woman's pelvis that produces the eggs of the woman and also has the capacity to produce hormones that make the woman to see men, the estrogens and the progesterones and the rest. So what can be done sometimes is not even freezing of the egg or the embryo. It's also freezing of that tissue. A portion of it will be cut off and kept in a container and frozen to be used at a later time. Usually there are different indications for all of these different types of fertility preservation in women. And the last, of course, is the transposition of the ovary. Now, this is simply moving the ovary from their normal location in the pelvis to a position that is higher, or to a position that is higher up in the abdomen, which is going to be far from the deleterious effects of certain treatments like radiotherapy for people that have cancers. So, just to state now, for men, I usually just have scrolling the side of men so that everyone is not left out. So for men, there are just 2 ways to preserve fertility in men. It is by sperm freezing and the freezing of the testicular tissue. That is taking a tissue from the testes of men and freeze them. And these are just the 2 methods of fertility preservation in men. However, for women, there are 4. So there are 2 main reasons. Just to make it, just to state it broad. There are 2 main reasons why fertility preservation is engaged or is done. Number 1 is for cancer treatment. Cancer patients, usually done for cancer patients because you have to preserve their fertility, because the treatments that will be engaged because of the cancer would attack these eggs, attack the sperms, and of course can kill the eggs and the sperms, and even attack even the ovaries and the testes. So that is number 1. And secondly, it's for delay of childbearing.
Okay, Dr.
So I'm
Collins.
going to stop here.
Yes, thank you so much. I was going to come in there. Yes, you've said a lot. Let me just do a quick check in case you just tuned in. You're live to Women Radio 91.7 FM. the first and only radio station for women and their families. And you're tuning to Radio Doctor. Yes, indeed. Today we're talking about egg freezing and fertility preservation. Who should consider it? And that's the topic today we're talking about. That's what we're discussing today on Radio Doctor. Feel free, of course, to reach us on the toll-free line. Females, you can call us on 0800 1235 917. And also, you can also reach us on 07000 917 917. 09155 917 917. Should you want to leave us a text or WhatsApp message, you can do that on 08155 917 917. 07031756537. All right. This topic concerns every one of us. We're talking to both the male and females today. We're talking about egg freezing. A doctor also referenced sperm freezing, and it talked about the different ways to freeze eggs, such as the ovarian tissue freezing. It talked about the egg freezing, the embryo freezing, as well as transposition of the ovary. Doctor, before you dwell a bit more regarding that of men, you talked about testicles freezing, sperm freezing. Before we delve into that, I want you to explain the difference between, some people confuse sometimes, embryo freezing and egg freezing. Help us differentiate.
Okay.
Yes.
All right. Okay, so basically, egg freezing and embryo freezing are two distinct subjects. They are quite different from each other. So the egg, so every month a woman ovulates, and when a woman ovulates, she releases an egg, one egg. Okay, so if that egg gets fertilized by a sperm, it becomes an embryo. Usually, this is the very first step to actualizing pregnancy. Okay, when that embryo implants inside of the woman, inside of the womb of the woman, then she gets pregnant, so to say. Okay, so the egg itself is that which is that cell, is the reproductive cell that is always released every month, in the middle of the cycle of the menstrual cycle of the woman, every month, so to say. Okay, while the embryo is the product that is formed from the union of the sperm and the egg. Okay, so these two cells can be frozen to be used later for conception.
Okay.
So for egg freezing, eggs are gotten from the woman. Of course, after having given, I'm just going to scratch the surface here. So after having given medications to the woman, the eggs are collected and then, of course, are kept in special storage containers and frozen. The embryo freezing, usually this is for couples, okay? This actually very, very is indicated for couples, really.
Okay.
People who are not ready to actually bring up a child, to raise a child at this particular moment. They can go back to the fertility clinic. And of course, after having consultation with their gynae or with their fertility physician, then of course, eggs can be gotten from the woman, the sperm gotten from the man, inseminated in the IVF lab. The eggs are inseminated in the IVF lab. The embryos that are formed, like I said earlier, which is the product that is formed from the union, from the fertilization of that egg, the sperm. Okay, these embryos are now frozen to be like you freeze it with the intent to transfer it into the womb of the woman at a later date when they are ready, when they are physically, emotionally, and every way ready to raise a child or to conceive and raise a child.
All right. Yes. In case you're wondering, that's the voice of our guest today on Radio Doctor, Dr. Collins Aboloje, who is an assistant medical director and fertility physician at St. Ives Specialist Hospital in Abeokuta. And that the program Radio Doctor is Nigeria's first specialized health program where medical doctors consult for free and, of course, advice on radio, on Women Radio 91.7 FM, talking about real issues affecting real people. All right, Doctor, I want to talk about now the category of people who should likely consider, be it male or female, be it the man or woman, who are those who should consider egg freezing and what age is advisable?
Okay, thank you very much for that question. So I'll start from the age, then I'll progress to the other part of the question.
Okay.
So for the age, there's the truth, to state openly, there is no specific age requirements, really, for egg to be frozen. However, there is a recommendation because of the potential to get the best quality of eggs from the woman. So the recommendation by fertility specialists and physicians and by the world governing fertility and all of that is that a woman should freeze her eggs when she's between the ages of 20, between from 20 to mid 30s. So we're looking at a 15-year period that is between the ages of 20 to 35 to mid 30s, which is 35. So this is the age range in which it is advised or it is recommended that the woman freezes her eggs because of the potential to get the best quality eggs. As a matter of fact, most physicians would even advocate for freezing your eggs before the age of 30. Well, the reason why I'm saying this is because sometimes we have to also take into consideration certain socioeconomic factors and all of that, and certain geographical distribution where everything doesn't seem equal as relative to what is obtainable in the Western world and all of that. So, but most doctors would advocate for eggs to be frozen between the mid 20s and mid 30s. Let's just keep it at that.
All right.
So so that's fine. But of course, women that are older than 35, women that even in their 40s can actually freeze their eggs. But it's important that it is stated to them that they know that the quality of egg gotten after the age of 35 is not the same as quality of egg gotten. And that is just to that is just for their knowledge.
All right, so, Dr. Collins, but
which girl or which woman can actually freeze their eggs? Okay, so I think I'll just
yes,
it's fine.
Okay, no, because you brought in the part of the male now, you talked about sperm freezing. I wanted you to also speak to that aspect. What age should consider, that's for the men now, is appropriate for sperm freezing? Then you can delve into other things you want to talk about.
Okay, well, I think for men, the best time to actually freeze sperm, usually it's when you're below the ages of 45. There's a reason for that. Yes, there's a reason for that. So after the age of 45, men also experience decline in their fertility generally, both in the sperm quantity and in the sperm quality. However, it is also possible to find men even in their 70s having excellent sperm parameters, both in quantity and in quality. So in this case, truthfully, it is not on the side of men, even though there is a recommendation that you freeze your sperm before at a certain age. But it's not like a one-size-fits-all, truthfully, because you can find men in their late 60s and even 70s having excellent sperm parameters. So, but the best time really would be when the man is 45 and below, because at that particular age, there's an excellent level, you expect an excellent sperm quantity and quality. Because after then, fertility decline also begins in a man. So that is the recommendation for the age recommendation. But now, with respect to the category of women or men that should engage this fertility preservation. So for women, if a woman has endometriosis, she is a candidate for egg freezing. Women who have autoimmune conditions that would require treatment with certain medications that are ovotoxic. Now, when we say ovotoxic, these are medications that can harm the eggs of women or harm the ovaries of women. Okay? So women who also have that.
I wanted you to give us in the layman term what you mean by endometriosis for those who may not understand that technical term.
Okay. Yes. Okay. So endometriosis is a medical condition where the tissue that is found in the inside of the womb called the endometrium. So these tissues are found in ectopic sites in places that are outside of the womb. Okay. So just take for instance. Now let me just say something. I'm trying to just give a picture that can be relatable.
Is it known as fibroids too?
So imagine finding hair inside. Okay. Yes. Imagine finding hair. Woman hair that goes on the head. Imagine finding it go inside of the mouth of somebody. So I'm just so that's just what endometriosis is. That's what it looks. So it doesn't look that way, but this is those just give a picture that people can relate with.
Okay.
So endometriosis is a condition where you find the endometrial tissue. That is the tissue that is supposed to be found inside of the womb, where that should allow for the growth and development of an embryo and a baby. Okay. So this tissue is found in ectopic site, in areas that are not inside of the womb. And when this happens, it can cause a cascade of inflammatory reactions and problems, hormonal disturbances, and a whole lot of trouble for the woman.
Doctor, is that what they describe? Okay, doctor, is that also what they describe as fibroid?
No.
Oh, okay, fantastic.
So fibroids are different. Fibroids are just benign growth.
Okay.
Yes, on the womb. Yes, or inside of the womb. So endometriosis is very different from having uterine fibroids. That is also a good question. Thank you. So,
all right.
So for some women, so other indications for women to freeze their eggs also include women who have to go for surgeries, maybe women that have to go for surgeries that involve their ovaries, and also women that have to that have the intention to delay childbirth. For men, some men would have decided to actually cut their or tie their spermatic ducts. That is as a form of contraception. Yes, that is a form of contraception for men. So before they do that, some men decide to freeze their sperm just in case they change their mind in the future to have more children. So they still have the sperms saved in the sperm bank to be used for IVF in helping their partners to conceive in the future. So that is what usually called this pre-vasectomy sperm preservation. So men have to freeze their sperm before they go for vasectomy, which is to cut or to tie or to ligate their spermatic ducts. For some other people, it could be for people who it's a means to preserve the sperms of sperm donors. So usually in the fertility clinic, there are certain people certain couples who are desirous of having children. Okay, and then the man doesn't have sperms at all. So such a man can subscribe to the use of a sperm donor, which is the use of the sperm from a third party, from somebody who is not known to them, or in some cases could be a direct sperm donation that is from somebody that is known to them. So this is also a way to preserve the sperms gotten from sperm donors. For some other people, especially in the Western world, people who are transsexual, trying to change from one sex to another and all of that. So some persons might still decide to freeze their sperm just in case they decide to switch back to the other gender. And then another modality, another indication for sperm freezing is for men who have poor sperm quality and they are still desirous of using their sperm for IVF or for fertility treatments in order to help their spouse get and conceive. Regardless of every advice and all of that. So men can still freeze their sperm, whether it is of small quantity or quantity or poor quality, as the case might be. For some men that prefer to go against medical advice any which ways. So that is also an indication for them to freeze their sperm. For some men, they find it very difficult to ejaculate. So as a result, they prefer to freeze their sperm at any time they are able to ejaculate. Just freeze their sperm, so that when it is time for them to help their partner conceive, okay, they won't find it difficult to ejaculate. So they already have sperms frozen in the egg bank. So I think I'll just stop here for now.
All right. Okay, 28 minutes past 10. You're tuned into Women Radio 91.7 FM, the first and only radio station for women and their families. And you're on to Radio Doctor. And that Radio Doctor is Nigeria's first specialized health program where medical doctors consult for free and, of course, advise on the station regarding real health issues for real people. And today we're talking about fertility. It's all about egg freezing and fertility preservation. Who should consider it? And I have the pleasure of my guest this morning, that's Dr. Collins Aboloje. And Dr. Collins Aboloje is an assistant medical director and fertility physician at St. Ives Specialist Hospital in Abeokuta. All right, do well to call me in. Let me know if you have concerns regarding egg freezing or even sperm freezing, like Dr. has rightly expatiated on. Do well to call me. You have challenges, you want to make inquiries in that regard. You're having delayed conception, be it male or female. You're having challenges with your fertility, or you have questions on your mind concerning, fertility, concerning this egg freezing and also fertility preservation or sperm preservation, as the case may be. You can do well to reach me on 07000 917 917 or 9155 917 917. Toll free line for female, you can call us on 0800 1235 917. I'd love to hear from you, but if you cannot call, it's okay. You can send me a text or a WhatsApp message. You can leave your messages on 08155 917 917 0703 1756 537. All right, let me keep on talking to Dr. Collins. We're talking egg freezing and fertility preservation. Who should consider it? All right, Doctor, you've spoken a lot about, types of egg freezing or sperm freezing, as the case may be. Just to help allay the fears of people, before I delve into that, let me remind our listener we're live on YouTube, streaming live on YouTube. We're very social. You can connect with us on Facebook, on Instagram, and X as well. Do well to follow us, like us, and leave a comment if you like to do that. Back to you now, Dr. Collins. I know you've spoken a lot about what this is all about, the concept of egg freezing, and all of that. But then, just to help allay the fears people may have regarding this particular innovation, how well, I want to peep into your world now as a medical doctor. How well do people subscribe to this particular innovation of egg freezing or sperm freezing, as the case may be? How recent or not is this technology?
Okay, thank you. So basically, in recent times, we've seen a lot of people coming for egg freezing. And sperm freezing has always been readily subscribed to, especially by clients that are residents abroad and they have their spouses in Nigeria. So what the man prefers to do is to come into Nigeria and freeze his sperm and goes back to the UK, to wherever he has to go to, outside of the country, and with the assurance that, of course, he's left his sperm to be used to help his wife conceive. So basically, sperm freezing has been readily subscribed to by men. And then on the side of the egg freezing now, emphasis on egg freezing. And there's a reason for that. Of course, women have started to subscribe to that, but it is not comparable to the number of people that are subscribing to embryo freezing. So you find couples who are residents abroad and would prefer to come over to Nigeria to have IVF done. So basically, they come over to the clinic, and then the procedure is started. Eggs are collected from the woman and sperm collected from the man, inseminated. The embryos that are formed are now frozen to be transferred later into the woman to help her to conceive. So basically, this is the more common modality or process that is engaged currently. But like I said, there's a lot of awareness now on egg freezing. Now, before now, the reason why a lot of people do not really do much of egg freezing is because of the lack of advancements in the method of freezing. So eggs have this susceptibility, they have this potential to be damaged by the freezing process itself. So not much eggs might be gotten after eggs have been frozen. So not much egg might be what's the word now? Might be recovered after when you want to use the eggs. Not much eggs might be recovered from that thawing process. So because some of the eggs might actually be lost. I hope you understand what lost means. Some of the eggs might be lost, like might die during the thawing process. Thawing simply means we hate to use this word because it is not the same. It's like defrosting, okay? Just permit me to use that word just for the lay public, because of the lay public. Yes, so basically it's defrosting, so to say, but it is thawing. So So not much eggs might be recovered. But in recent times, there's now been a lot of technological advancements, via this vitrification method, which is the ultra rapid freezing method. So a lot of eggs can be gotten, even up to 80% of the eggs that were frozen will be recovered. So this is the reason why now a lot of people women can now subscribe to egg freezing and not embryo freezing. So the embryos are more tolerable to the freezing process, the vitrification, the freezing modality or vitrification as case might be. They are more tolerable, and then you have a higher chance even to recover embryos than recover eggs. Okay, so this is, but in recent times now, because of this technological advancement, people are subscribing to egg freezing, and of course they're able to get back a lot of their eggs. At least even up to 80% of the eggs that were frozen can be recovered during the thawing, after the thawing process. So this is basically what we are currently seeing now, currently experiencing.
All right. Correct me if I'm wrong, Doctor. Do you mean to say that in the process of trying to freeze certain eggs, some eggs may be destroyed in the process?
Okay, so now in the process of freezing the eggs will not be destroyed.
Okay.
But in the process of thawing it, in the process of thawing, I said I used that expression earlier to frosting. Okay, trying to now take them out of the ice, out of that frozen, that cryo state. Okay, to be used for IVF treatment. Some of the eggs might become damaged, and as a result, But in recent times, because of technology and how advanced technology of sperm organic freezing has become, there are no fears in thawing these eggs anymore. So there are no fears. So because a lot of the eggs will be gotten. In fact, in some centers, all eggs can be recovered.
All right. In case you just tuned in, you're live with Women Radio 91.7 FM, the first and only radio station for women and their families. And yes, you're listening to Radio Doctor. And today on Radio Doctor, we're discussing something very, very, very critical, something that may interest you. In fact, that should interest you as long as you're female or even a male. We're talking egg freezing and fertility preservation. Who should consider it? Yes, egg freezing and fertility preservation. Who should consider it? And of course, like I mentioned before, you can connect with us live on YouTube or streaming live on YouTube at WFM 917. Feel free to connect with us on X, on Facebook, on Instagram, on where else? Okay, even on TikTok, we're there. You can do well to follow us, like us, or even leave us your comment. And yes, today on Radio Doctor, I'm speaking with Dr. Collins Aboloje, who is an assistant medical director and fertility physician at St. Ives Specialist Hospital in Abeokuta. Now, Dr. Collins, I know we've spoken a lot about the differences between egg freezing, embryo freezing, and all whatnot, and why we seem to have, patronage when it comes to embryo freezing. You've also expatiated on modern technology that seems to eliminate all of those risks associated with the initial stage you had before recent technology when it comes to egg freezing. But then people have this, should I call it concern or even myth when it comes to egg freezing. Some have different speculation, different idea as regarding, what could be the consequences, so to speak, or side effect when it comes to egg freezing. So help us understand, Doctor, what are the potential risks or even side effects or consequences, if you may, when it comes to egg freezing procedure?
Okay, thank you. So some of the consequences that may arise or side effects, as the case might be, are not actually attributed to the egg freezing process itself. It's actually attributed to the process of collecting the eggs from the woman. So basically, for a woman who wants to freeze her eggs, have to also go through through the procedure that looks like as though she's doing IVF. So basically, what it simply means is that after consultations and all of that, medications are given to the woman, injections actually, they are hormonal preparations that are given to the woman over a period of time. And then, of course, these eggs are then collected through a procedure called the oocyte retrieval. Okay? So some of the side effects that will be experienced by the woman are actually the ones that are as a result of that oocyte retrieval, and even and then the extended period of taking hormonal preparations, injections, and the rest. And some of these side effects include lower abdominal pain, vaginal soreness, and even some bleeding possible. And some people could experience moodiness and all as a result of the injections and the hormonal preparations that they take. And of course, the most dreaded side effects that even we as doctors are actually very careful about is the ovarian hyperstimulation syndrome, which is because it's actually a consequence of stimulating the ovaries, giving these medications to the woman, injecting the woman with hormonal preparations to cause more than one egg to grow in the ovaries. So when a woman wants to do egg freezing, we are actually advocating for the woman producing a lot more eggs so that a lot of eggs can be frozen. So you just don't want to get just one egg and freeze one egg. It defeats the entire purpose. So basically, you want to give injections to the woman to cause her to produce roughly between 15 to 25 eggs thereabouts. Some other different centers have their what I call it now, their goal and their aim. So but basically you just expect a woman to produce a lot of eggs. So some of the consequence of that action can be ovarian hyperstimulation syndrome. And in all honesty, ovarian hyperstimulation syndrome can be averted by the type of protocol that is engaged during the stimulation process. Okay, so but basically these are some of the side effects generally. Now, with respect to the freezing process itself, like I said earlier, sometimes during the thawing process, okay, some of the eggs might be lost, might be damaged. As a result, they won't be usable. Okay, some of the eggs, not all. Okay, so it also still depends on the center where you're doing the egg freezing. Okay, and what their oocyte recovery rate looks like. Okay, in very good centers, you get up to 80%. Of oocyte recovery. That's egg recovery, getting the eggs back from that thawing, from that frozen state. Okay, you get up to 80%. In other centers can be lower, and even other centers can even be better than 80%. So these are some of the risks associated with this process. For some other persons, you never can tell. You cannot rule out errors that are attributed to man, to being human. Okay, where even the eggs can be, wrongly labeled and transferred to somebody else and all of that. So of course you can't rule out some of these, but like I said, in the best centers, of course, everything is done carefully and meticulously, so as to avert some of these possibilities.
All right, doctor, paint us a picture. Just give us a mental frame. When it comes to egg freezing now, just give us that mental picture. Walk us through the process from start to finish, from the pre to the actual process itself, and also post process. Walk us through.
Okay. So the procedure for egg freezing usually is simply broken down into about 5 major steps.
Okay.
The first, of course, the fertility consultation by the woman or the couple, as the case might be. So they come over to the hospital where they consult with their gynaes or fertility physician in the fertility clinic, of course. Tests are conducted. Scans are also done to be sure that this woman even has ovaries, and she has ovaries that have antral follicles that contain eggs, so to say. Okay. The next, of course, after all of that has been concluded, of course, we head straight into the ovarian stimulation. Ovarian stimulation is simply the act of giving hormonal preparations in the form of injections. Okay. So to the woman, to cause the follicles inside of the ovaries, that's the follicles, the structures containing the eggs inside of the ovaries of the woman, to become mature. Because only when these follicles grow to a size of maturity, that is when you can be able to retrieve, to obtain, to get eggs out of the ovaries. Okay, so this stimulation is done, and after that, you proceed to, after these follicles have attained follicular maturity and all of that, you head straight to follicular aspiration. Usually days allotted to this follicular aspiration. So follicular aspiration is a procedure that is done inside of the theater in the hospital. So the woman is brought into the hospital, she is put to sleep. After, of course, consent has been obtained from her again and again. Of course, she's put to sleep, and then the follicular puncture and aspiration of the follicular fluid is done. That the fluid is just simply the fluid, the environment where you find the egg. Okay, so and then this fluid is gotten and given to the embryologist, who then uses his microscope to analyze the fluid and all of that and pick out the eggs. The eggs are always found inside of the follicular fluid. Okay, so the eggs are then collected or isolated from that fluid, and then of course they will be prepared, washed, and there's something called decumulation. Okay, these are just our medical grammar. Simply means that the egg they are sort of fused. Let's use that word. Okay, all the surrounding things that anchor the egg to the follicle, to and all of that is removed, and then of course the egg itself is now kept into a special container where a cryoprotectant is actually placed. Okay, so cryoprotectants are media or substances that will protect the egg in that frozen state. So the eggs are placed into these cryoprotectants, after which they are placed into special containers and then frozen in liquid nitrogen. So basically, the liquid nitrogen is what is used. So just to state, so when you're freezing your eggs, the eggs are not kept in the freezer, please. The eggs are not kept in the freezer or in the fridge. They're actually frozen, in a container that contains liquid nitrogen. Okay. So it's an ultra rapid process that is done within the blink of an eye. That's the entire eggs or sperm and sperm will be frozen, but in this case, eggs. So they are frozen rapidly at minus 196 degrees centigrade. Okay. So basically, after all of this, so after the eggs have been collected from the woman and given to the embryologist, he has to do his own part, which is what I just highlighted for you now. So, but for the woman herself, she's able to return back. So once she wakes up from anesthesia and all of that, she's able to return back to her home the same day, and go about her activities within the next 2 to 3 days. Of course, not leaving out some of these side effects that I listed earlier, like vaginal soreness, lower abdominal pain at the site of injection, and all of that. These are some of these side effects that she would experience. But it is important to say that these side effects are transient. So you just experience them for a couple of days, and then, of course, they wear out. They wear out, and by the next week, the woman goes about a normal activity like every normal woman would. So they are quite the side effects are quite transient. So when she's ready to use the eggs, of course, they will be thawed and inseminated to become embryos, and these embryos are now transferred to her in an IVF procedure. Yes, through IVF.
All right.
That is what we do.
Okay, we're pressed for time. 13 minutes to 11. You're tuned into Women Radio 91.7 FM. The program is Radio Doctor, and today we're talking egg freezing and fertility preservation. Who should consider it? I'm speaking to our doctor here, Dr. Collins Aboloje, who is an assistant medical director and fertility physician at St. Ives Specialist Hospital in Abeokuta. My name is Adibola Adidigba. You can still do well to reach us on the lines 07000 917 917. 09155 917 917. Ladies, you can do well to reach me on 0800 1235 917. Should you want to leave a text or a WhatsApp message, you can do that on 08155 917 917. 07031 756 537. All right, we're pressed for time, but then I have a couple of questions still for Dr. Collins Aboloje. Doctor, help us understand, how long can eggs remain frozen and still, be potent for use?
Okay, so the eggs can be frozen for an indefinite period of time. Okay. You can decide to freeze the eggs for 10 years, 20 years. I mean, it will still be usable when necessary, when the time comes.
Okay. All right. I know people are wondering, okay, we're talking egg freezing, we're talking fertility, but how affordable? Some people think, it is too expensive, it's too cost. I mean, egg freezing, how affordable is it? How accessible is it to the average Nigerian woman out there?
Okay, so basically, when a woman starts or when a couple starts to talk about egg freezing, they have to be ready for two things. Number one, they have to know that first off, they already subscribed to doing IVF. Okay. Because when you freeze the eggs, the only way you can be able to transfer the products that is formed from the insemination of that egg later, okay, is through IVF. So they have to know that, yes, if I'm going to freeze my egg, and I also have to know that I will be doing IVF when the time comes for me to receive my egg or receive the embryo. Okay, so basically, now for this, on the average, IVF is quite affordable even in Nigeria. So as a result, we have a lot of people coming out from the diaspora to come to seek IVF services in Nigeria. On the average for IVF, well, I know of a few hospitals. Then you should be looking at for the procedure itself, the ovarian stimulation and the egg freezing. You should be looking at something between 3 to 4 million. And the payment is not a one-off, really. It's not really a one-off payment. You just pay and they just go and sleep. No, it doesn't work that way.
Okay.
Most IVF clinics will freeze your eggs for a particular period of time, after which you have to renew the subscription. Just like you do to your DSTV or to your whatever. Yes, you have to renew the subscription. So you have to renew the subscription for the payment of it. To keep those eggs frozen. Yes. So usually we're looking at roughly 3 to 4 million naira on the average. On the average.
All right, doctor. Explain to us in a minute if you can, because I still have questions for you. What lifestyle or health factors should women pay attention to while planning for future fertility?
Okay. So basically, I think it should even be an anthem already on the program. So basically, we just advise women to, of course, live a healthy, just keep a healthy routine.
Okay,
by engaging in a balanced diet. Diet are rich in fruits and vegetables, leafy greens, things like avocados, pomegranates, blueberries. Just things that just improve your antioxidants, and that are a rich source of antioxidants to the woman. Of course, she should avoid stress by trying to relax, and of course, engage exercises 2.5 hours a week. Avoid alcohol, avoid smoking, both active or passive smoking. And of course, take supplements generally. There are a lot of supplements out there, folic acid, coenzyme Q10. So the reason why you have to do this is so as to maintain the egg health, okay, to keep the eggs in a healthy condition. Because when you engage all of these unhealthy life practices, taking fast food, and all of that, increasing your body weight, like you said the last time I was on the program, of course, this can damage the egg quality, and of course reduce even the egg quantity, and also affect even your insulin profile and predispose women to having conditions like diabetes and the rest. So basically, living a healthy lifestyle is advantageous to the woman, not generally, and of course with the added advantage of also protecting the eggs.
All right, doctor.
Keeping them in.
I can't help but still wonder and ponder on the amount she gave, the average amount she gave when it comes to egg freezing. Talking about 3 to 4 million. I've been pondering over it, while you mentioned that figure, and it makes me wonder to the average trader out there, in Oyingbo market, who just sell her market, and she wants to freeze her eggs. How possible is it for her to have, for instance, a government backup? Do we have government policies or health insurance or even hospital programs that support fertility preservation?
Okay, well, there are some few hospitals that usually have programs that subsidize fertility-related programs. Okay, fertility-related procedures, for their clients or the public, for anyone who is willing. Okay, so but in Nigeria there are no national or no federal programs that would reduce fertility preservation. It's just something that is just going to start gaining traction soon. But in the Western world, there are some centers out there, in the Western world, outside of this country, Singapore, Australia, US, and the UK, where they have subsidized programs for people who are willing to freeze their eggs and all of that. But the truth is, none of these programs are actually free.
Okay.
They are not free. Yeah, they're not really. These programs are not free. Like, you don't pay a kobo to get this procedure done. You have to there's this insurance coverage and all of that, and you pay for it. You pay for your insurance. It's not something that you just go into the hospital and be like, yes, I don't have any insurance and all of that, and then I want to freeze my eggs.
All right.
There are no such programs because yes, at some point, one way or the other, there is some commitment you have to make financially. But currently in Nigeria, we don't have any programs for that. Yes, there are a lot of affordable IVF programs, but none of them, regardless, you still have to pay something at least.
Okay, this is
in the tune of what
I have to come in there, doctor. This is where we have to draw the curtain. But in less than a minute, if you can, Dr. Aboloje, I mean, what's your final words to anyone out there worried about their biological clock and not ready for motherhood yet? In just less than a minute, we're pressed for time. We have to leave it here.
Oh, okay. Thank you. So basically, there are a lot of reasons for delaying child conception and the rest. So people have their valid reason. But regardless, we also have to look at what is happening currently in the world.
Okay.
Infertility rate is rising, and a lot of women even are not even willing to conceive immediately once they get married, or not even willing to even get married or even talk about having children at this moment because of socioeconomic realities. But then, of course, if for all that is worth, I think we can still try to match up what is happening globally with respect to infertility as it rises, and of course, make decisions, necessary decisions. So, like I would say, I think it's not like a one size that fits all. It's not a one size fits all kind of situation, but really, this fertility preservation and of course, early conception and all of that is also something that will prove handy in combating this rising increasing rate of infertility.
Okay. Thank you so much, Dr. Collins Aboloje, Assistant Medical Director and Fertility Physician at St. Ives Specialist Hospital in Abeokuta. Thank you so much for your time today. And to all those who listened, thank you so much for listening. Thank you once again. You can do also stay tuned to this program coming up tomorrow, talking about Radio Doctor. Do want to connect with us on Facebook, on Instagram, on X. Like us, follow us, or leave a message. And then, of course, we'll be there to respond to you. Until next time, stay healthy and keep winning. My name is Adebola Adiduba. Bye for now.
To sponsor this program, call the number 0816 480 7613.
It's time to celebrate those who make a difference in empowering women and families. Introducing the VOW 2025 Award. The VOW Awards honors outstanding individuals, both men and women, as well as organizations that uplift and support women and families. Nominate inspiring changemakers and trailblazers